Right. Hello, welcome everybody. We are so glad to see you here tonight or this morning for those of you joining from Taiwan. Thank you for coming to our event through the George Washington University Sigur Center for Asian Studies. We are so happy to present to you Digital Tech and the Pandemic, learning from Taiwan's crisis management and beyond. So before we get started, I have two reminders. The first is that for this event, we are doing a question and answer session at the end, but you're welcome to ask your questions throughout the event. You can do that by entering them in the bottom right Q&A box. And then the second reminder is that this event is being recorded and it'll be uploaded to our YouTube channel. So without further ado, I'd like to introduce our moderator for today, Dr. Deepa Ollapally. Dr. Ollapally is the Associate Director of the Sigur Center, and she is a research professor of international affairs at the George Washington University.
Thank you so much. Good evening from Washington, D.C., everybody, and to our friends in Asia, good morning and welcome again. We have a terrific roundtable ahead of us on a subject that I think is still very much on all of our minds, the pandemic and what we need to do better to keep it at bay. We're not out of the woods yet, but I think we can see the light at the end of the tunnel, to use some mixed metaphors here. As we move forward, I have to say that many of us are looking to Taiwan to learn from its really praiseworthy handling of the pandemic from the get-go of the crisis and beyond. And of course, one key feature of Taiwan's success has been its deployment of digital tech, which is, again, something that is quite novel for many in the rest of the world. To lead things off today, we have none other than the trailblazing digital minister of Taiwan, Audrey Tang. Minister Tang has become a global personality thanks to her path-breaking efforts in the digital world to control the pandemic in Taiwan with open governance as well. Indeed, I would say she has helped to put her country in the global limelight. Now, Audrey came to her job having already received much accolade for work in computer science and open government. I don't want to read out her long record of achievements because we only have 1 hour here together, and you can find the bios on our website. She's going to speak for about 10 minutes, maybe 8 to be exact, she said, following which I will then introduce our two other distinguished academic experts to give their commentaries. I should say that I'm honored, really, to welcome the minister back to the Sigur Center. She was here, I don't know if you remember, Minister, but you were here last in February 2020 in person, just as the pandemic was breaking out. And I recall that you were already digitizing Taiwan's response from our conference room. So Minister Tang, how did Taiwan hack the pandemic, get ahead of the crisis, and manage to do all this and make Taiwan's democracy even more invigorated? The floor is yours.
Thank you. I'm really happy to be back, well, virtually back, and good local time, everyone. So I'm really attributing the digital social innovation to 3 pillars that helped our counter-pandemic response. I remember when I last visited, we talked about how to counter the infodemic, then called the disinformation crisis, with no takedowns. And that's a very similar situation with a biological virus that we managed to counter without lockdowns. And there are 3 pillars in our digital social innovation approach, and they are fast, fair, and fun. The fast part pertains to collective intelligence. Indeed, our response started on the first day of 2020, because around the end of 2019, Dr. Li Wenliang from Wuhan did post this social media post that said there were 7 SARS cases in the Huanan seafood market. Now you see in Taiwan, there is the PTT, which is roughly equivalent to Reddit, except it has no shareholders or advertisers. It's a pure academic network supported for 25 years, a pro-social social media in the civic sphere. So it's only on PTT did people contribute and triage the message that enable us to begin our response early and start health inspection for all flight passengers coming in from Wuhan to Taiwan on the first day of 2020. But collective intelligence is not just for people who can navigate bulletin board systems. It's also for toll-free numbers 1922, for example, where anyone can call from a landline. And for the past couple years, really, the 1922 has been a wealth of collective intelligence of people pointing out what we need to adjust on the ground. For example, last April, there was a young boy that called saying, "You're rationing on mask, that's great, but all I got was pink ones, which is not great. All the boys in my class have navy blue medical grade masks, and I don't want to wear pink to school." Well, it's escalated to the Ministry of Health and Welfare immediately. So on the very next day, at the suggestion of the participation officer, officers dedicated for public engagement, at the suggestion of the MOHW participation officer, all the medical officers wore pink masks, and Minister of Health and Welfare Chen Shizhou even said that Pink Panther was his childhood hero. So the boy became the most hip boy in his class, for only he has the color that the heroes wear, and the hero's hero, I guess, wear. And thanks to the open access Creative Commons license of those communication materials, it suddenly went viral. Pink became the most hip color, and people then started wearing masks out of fashion and self-expression reasons rather than just to comply. So a lot of mask rationing actually was not government technology, but rather social technology from the G0V Gov0 community and beyond. You see, in Taiwan, the digital services from the government are something the GOV.TW, but there's a bunch of people, tens of thousands of people, looking at how to improve it and hosting it under something the G0V.TW. So just by changing an O to a 0 on your browser bar, you get into the shadow government that's always more fun and more interactive, and always open source, so we can always merge it back into the public service. Last February, when we started rolling out mask rationing, immediately Gov0 people created this map, and we call it reverse procurement because they first had a spec, and then we have to fulfill the real-time open API updated every 30 seconds on the inventory of masks available in each and every pharmacy. So when people are queuing in line, they can check their phone for the map or chatbot or voice assistants even, and see that we're indeed rationing out it fairly, that people queuing before them, after they finish a purchase, the number goes down immediately on their phone, and they can navigate to the places where there are still some masks available. And also, like the OpenStreetMap community can co-create better distribution and pre-registration ways to distribute those masks. So we get 3/4 of people wearing and accessing the mask almost immediately, after which the R value became much less than 1, actually 0 for around 10 months. Now, in this May, when we face our real first wave, we were able to counter it within just a few months by shortening the contact tracing time from previously 24 hours to less than 24 minutes. And again, thanks to the Gov0 community, who invented a check-in way using the built-in phone on your phone camera without having to download anything. So just point your lock screen camera to a QR code like this, and it pops up a SMS already composed to 1922. All you have to do is to press send. So it's just literally a couple of seconds. And the SMS has this 15-digit random code that says for epidemic control use only. So people can rest assured that it's not going to compromise their privacy or security, for it's like a post-it note that's stored in your telecom carrier, and it's automatically deleted after 4 weeks if no contact tracer looked at it. And when a contact tracer does look at at it, well, you get a mutual accountability by a reverse lookup on the access records. Again, very transparent and also participatory. Now, in addition to those infrastructures from the civic side, we also have infrastructures via Creative Commons on the public communications. So this is the spokesdog, literally a Shiba Inu, right? So when we explain physical distancing, we say when you're indoor, keep 3 Shibas away from one another, outdoor 2 Shibas, wear a mask to protect your own face against your own unwashed hands, and so on. Because it's hilarious, it's actually more spreads to more people compared to the conspiracy theories or disinformation, and we call this humor over rumor. So this applies not just to our communication materials on pandemic. It's been like that since we classified digital public infrastructure as infrastructure. So using infrastructure budget, we can, for example, digitize the model of our presidential office, our national dictionary, even my own portraits and interviews are in the Creative Commons for each and everyone to maximally reuse. And I believe that's how we work, not for the people, but with the people, to enable the social innovators to look at not just what of the policy made, but also the how and why of why we make such policies and participate meaningfully in it. So this is literally my office out and on this slide. It's Social Innovation Lab. Anyone can visit me for 40 minutes at a time with the only requirement that the entire transcript or recording is uploaded into the Commons. And I discovered that people become pro-social and talk only about global sustainable goals, things that are good for our next generation, because they know that it will look really bad to our next generation if they talk something that's purely selfish. Okay, so that's how we enable digital social innovation, and I look forward to the panel.
Thank you so much for that. I can see why you've made it so irresistible in some sense for people not to join the effort with you. So clearly you have an incredible example that only others can only hope to emulate. The humor over rumor, I think, would serve us greatly if it only one could make that happen elsewhere. Well, the minister has kindly and graciously agreed to stay for the full hour, so I'm going to hold any questions for her until the end, until the other 2 speakers have completed their remarks as well. So now it gives me great pleasure to introduce 2 outstanding scholars, one my colleague here at GW, and the other person all the way from Taiwan. I'm also going to keep their intros short so that we have more time. Their bios are also on our website. First, let me introduce Dr. Chelsea Chou. She is an associate professor at National Taiwan University, and her research lies in the political economy of policy reform with a focus on health and social policy. Dr. Chou received her PhD in the Department of Government at Cornell University. She has published widely, and today she's going to give us a broader picture of Taiwan's COVID management, including social and digital strategies and her own perspectives on this issue. I also invite her to comment on the minister's remarks as well. Following her, last but not least, we have Dr. Lorien Abrams, who is Professor of Health Communication and Marketing at the Milken Institute School of Public Health at GW. Dr. Abrams also has a lead position at GW's Institute for Data, Democracy, and Politics, which is, I think, a very interesting and new institute here at the university. She's also, of course, a very prolific author, and currently she serves as an advisor to the WHO's Be Healthy, Be Mobile initiative. She's going to round off the round table by talking about the big picture perspective on global public health and the use of digital tools for health promotion, as well as offer her own thoughts on Taiwan, which she's recently become interested in, and perhaps on what the minister had to say as well. So I invite Dr. Chou now to take the floor. And keeping with our digital tech theme, all of our presenters today will be using PowerPoints.
Yes, thank you. Good evening and good morning. I'm very glad to be here. So in the next 10 minutes, I will first talk about some supplements to Audrey's presentation, and then I will talk about my own observation on Taiwan's major policies, including the border controls and the domestic QR code. And then I will use a first-hand survey to talk about the effect of the risk communication done by the government, as also illustrated by Audrey. And its own influences on the calculation and development of people's public health habits. Okay, so I am a political scientist. I have long been a country expert of a global project, which is on the varieties of a democracy. So on a global scale, we can see that, in fact, Taiwan's achievements are not only in the control of the number of infection cases. More importantly, Taiwan has been able to manage its state capacity in handling the crisis, but at the same time, is able to maintain the democratic principles at the same time. As we can see from this figure, from the 7 measures of Taiwan's pandemic control, we do not see significant violations according to those democratic principles. Okay. As I mentioned, the major policy tools for Taiwan to prevent the COVID spread, first is the border control. As Audrey also mentioned, that the government started to conduct intensive inspection on the flight from Wuhan in the very first of the outbreak in January 1st of 2020. Starting from the mid of March, we also initiated a policy to have all the overseas passengers coming to Taiwan to stay in a home quarantine for 2 weeks for 14 days. So for those passengers, when entering the country, the government will send a health declaration certificate and a home quarantine notice indicating the end date of the quarantine to the passenger's mobile phone via SMS, the short message service. So this means that all the passengers will need a Taiwan mobile phone number, okay? And the CECC, the Central Epidemic Command Center, uses the phone to trace the real-time location during the quarantine period. And the district office staff is responsible for daily contact with the mobile phone to ensure the person staying at home and to check if he or she have any symptoms. And the travel history information is integrated into the National Health Insurance Database. So in the primary clinics and hospitals, those travel history, along with the clinical symptoms, is the most important information for doctors to identify cases. So in Taiwan, every citizen has a health insurance IC card, which stores the person's medical history. And during the pandemic, these databases is very important and serve as the foundation for frontline medical professionals to identify and to trace and to reach possible suspects, including those with mild symptoms and overseas histories, as well as those who have gone to check their breathing problems for multiple times, as this indicates a high risk. And the border control policy is very much welcomed by most Taiwanese people. And this successful story of tracing overseas history enhances the popular support for domestic tracking. As Audrey mentioned, Taiwan's QR code scanning is very convenient and fast. Toward the end of my presentation, I want to use the first-hand survey data. This is the online survey data, which is part of the international collaboration on Taiwanese people's response to the COVID and their responses to the government's policy suggestions. As Audrey mentioned, the CECC press conference every afternoon provides the most important venue for the government to communicate the COVID risk with the public. And in this questionnaire, we asked the interviewees, like, how often do you watch the CECC press conference? And as you can see, there is a significant proportion of people who either watch it every day or several times a week. And the results shows that watching this conference is highly related to the enhancement of public health habits. So we run a few regressions, and we found that the relationship is significantly important. In addition, the survey also asked about people's evaluation of the government's policy. And we can see that watching the press conferences more frequently is also related and associated with the level of the support of Taiwanese government's policy. Apart from the statistical results, we can also see there are some kind of challenges for Taiwanese government to put forward more collaboration within the different segments of the society. As we can see that the Taiwan identity, and I don't have time to explain the details of those indicators, but this represents the different political party identifications. And we can see that these two variables are also significant in explaining the evaluation of Taiwan's policy responses to COVID. So I guess I would say that the first challenge for the Taiwanese government is to respond to different political parties. And the second challenge is probably also related to the border control, as we have been very successful in preventing the virus to come into Taiwan. So in the future, will the population support the border reopening, and what kind of supplemental policies are needed when we reopen the border? So those are my own reflections. So thank you.
Thank you very much, Chelsea, for those that careful research you've done into public opinion surveys. Clearly, there's a lot that you've gained from those public opinion surveys, which I think will help the government and vice versa. So very good. It shows that, you know, it's not all fun and games. There's a lot of effort that's gone on to this as well. All right, and now let me turn to Dr. Abrams.
Okay, I'm going to share. I don't know why my sharing's not working quite right. It worked a little while ago. Let me do it again. I have some new options, I think. One more try.
It worked for a second.
Did you see the PowerPoint? No, right?
Something came on that looked like a PowerPoint, yeah.
It says share screen, but it doesn't give me the options that are the different windows that I had. Window, file, whiteboard. It just looks different than a minute ago. I'm trying to share my PowerPoint. Can you see it now?
Yes.
Excellent. And now, yes.
Got it.
Okay, we did it. Yay. All right, so we're going to be talking about technology, and it's always good when you start with a technological problem and you're talking about the strengths of technology, because it's a reminder of the weaknesses too to work out.
Perfect.
So I'm a professor of health communication and marketing, and I'm really going to focus on health communication principles and then think about it in terms of principles and the opportunities we get from mobile technology. So I'm going to cover these 4 principles, and I'll go over them briefly and then each one in a little bit more depth. So messages should come to the user, and these are communication messages, should communicate about theoretical constructs, and I'll go a little bit into these. Messages should be engaging, and messages should consist of a few simple messages repeated often by a variety of trusted sources. So let's start with messages should come to the user. I mean, when we think about mobile technology, there's no better way to get a message to the user than, or one of the very best ways is through their mobile phones. In a place like Taiwan, about 84% have a mobile phone. They have a 84% have a smartphone. Additional 12% or so have a regular phone, and then it's a tiny 2% or something like that that doesn't have a phone at all. So there's our opportunity. I'm part of a initiative at the World Health Organization called Be Healthy, Be Mobile, which has sought to think about how we could make use of mobile phones for health promotion. And WHO has put together toolkits on tobacco cessation, diabetes, prevention, and cervical cancer screening, and helped countries throughout the world use these toolkits to get national programs up and running. And often the programs are run on SMS, just like this example here. Welcome to Text to Quit. We'll send you advice on quitting smoking, even if you're not ready to quit. Reply yes to join. And sometimes they're SMS, sometimes they're WhatsApp, sometimes they're Facebook Messenger. It doesn't really matter. The technology is pretty similar, but we've been able to create these interactive automated programs that in many cases have a strong evidence base to support them on a national level. In the case of COVID, they've also studied how do text messages work just in increasing COVID vaccinations, and there's a very rigorous study that came out of UCLA, which shows that just getting one text message can increase your likelihood of getting that says you should get vaccinated. There's a vaccine waiting for you at your hospital. Just one simple message could get you to increase rates of vaccination. And if you send a reminder, the rates go up and so forth and so on. WHO has also become involved in creating COVID-related communications. Obviously, on Facebook, they have a big part of the COVID Information Center, and they also have a chat bot that was originally on WhatsApp, but now has moved also to Facebook Messenger, where you can get the latest COVID information by typing in a question or replying with a country that you're interested in, and then an automated system will give you more information. So that's the case for messages coming to the user and having high reach. Another principle is that messages should communicate about threat, such as the severity and susceptibility, the benefits and barriers of acting and self-efficacy. And these are kind of the core principles that we talk about in many of our theoretical models of health communication, such as the health belief model. I'm not going to bore you with too much theoretical information, but just a call out to theory. And in looking at WHO information, and this comes from their misinformation toolkit, you can see those principles reflected in their messaging. Being vaccinated reduces your risk of getting seriously sick with COVID-19. And so they're talking about the susceptibility and the severity of COVID-19. And then they translate it into the different kinds of social media platforms. So you can have a short message on Twitter or a longer message, for example, on Facebook. And I know I'm talking a lot about messaging and communication, but I just want to point out that there's a big place for communication also with policies. So communications can be standalone, and you could just send someone a message, you should go do this, and they'll go do it. But it's only in certain cases. So it's when it's easy to see the to see the benefits, and there's a lot of self-interest involved. There are few barriers to performing the behavior, and there's high self-efficacy. But in the case of many of our COVID-related behaviors like masks and vaccines and quarantine, policies do help. And so it's really important to have policies and the communications be integrated into that. And that's for in cases where there are fewer less self-interest and fewer individual benefits and maybe community benefits. And so people need more convincing to do the behavior. Okay, messages should be engaging, and I'm so excited to know Taiwan and how engaging their communications really are. I love the examples we saw earlier from the minister. So one example that I came across early in the pandemic was this example from Vietnam, where the Ministry of Health in Vietnam worked with a popular pop star to create, it was an animated YouTube video about how to protect yourself from COVID. But then it was quickly, it was a song and it was catchy and it caught on and it became a TikTok dance and it went viral. And so that kind of engagement is so important. And I'm so excited to know about the spokes dog in Taiwan, Shiba Inu, and how effective that is in communicating to the public. And then finally, messages should consist of a few simple messages repeated often by a variety of trusted sources. Ideally, you have all parts of society on board with the same messages. You have the government, and you have the religious leaders, and you have the entertainment stars, and everybody's saying the same thing. And so it's sort of like surround sound, and people are getting the messages and accepting the principles behind them. We wrote an article in the Washington Post talking about how, well, we were having troubles with our White House communication and how we needed to call upon our entertainment leaders like Taylor Swift and LeBron James and Kim Kardashian. But the problem is actually bigger than just getting everybody on board saying the same thing, because of digital media, and this is a downside of digital media, we have a situation where we have a lot of misinformation that travels fast. And so that makes messaging harder, and we need to address the misinformation. And so that would be another really important point. And I was pleased to find that the World Health Organization has now put together this Tackling COVID-19 Misinformation toolkit for healthcare practitioners. And we at GW are also involved in similar kinds of work and really putting together, recognizing that we need all of our healthcare workers on board with messaging, and to the degree that it's possible to train them to use social media to advocate for these health behaviors. So again, we end up with less misinformation and in more places and more spaces, hearing messages that are evidence-based and support COVID prevention measures. And then I was really pleased to see that the Ministry of Health in Taiwan is doing similar work. And they have a program where they reply really quickly in 20 minutes with 200 words and 2 images, the 222 plan, which I never heard of and I think sounds really good, where if misinformation comes out, the Ministry of Health is quick to respond with an official account and to point out that it is misinformation. So those are the 4 principles that I think would guide my work in communicating about COVID. When I think about Taiwan, I really am impressed by all of their efforts. I applaud them for the management and using many of these communication principles in their communication campaigns, their social marketing, and where needed, where they've implemented stringent policies. Really, Taiwan's been a real leader in understanding the technology and harnessing the power of the technology. And I think of their response on Twitter to misinformation, the app that they created for mass distribution, and you can stand in line and see in real time what the inventory is on those masks. And then also for implementing a strict quarantine with digital tracking on people's cell phones. And I know there's a lot of concerns about digital tracking. You know, this is an invasion of privacy and people have to give up rights with the quarantine and the digital tracking and what they call electronic fencing, where they follow people through different cell towers and they can see if they're leaving their quarantine. But really, Taiwan has gained freedoms in their community, having returned to daily life, which many places still don't have, and avoiding so much loss of life, which here in the United States, sadly, we've had, 700,000, more than 700,000 people die from COVID. So I applaud the example, and it's been wonderful to learn about it. Thank you. Let me stop my share.
Thank you so much, Lorien. I'm glad you figured out the tech glitch on your own pretty quickly. So, all right. Well, I think we have had a really great snapshot as well as an overview of Taiwan, as well as the global situation on dealing with the pandemic using these new tools. And I invite the audience to submit the questions that they might have for any of the speakers or all of the speakers. And while we're collecting the questions and while the audience members are perhaps formulating them, we now have a few minutes among ourselves to engage in a little dialogue, if you like. And so let me, if I may, start by asking a question first to the minister, and maybe others will join in also, because before we started, we were in our practice session, we were talking, you mentioned issues that we didn't really talk too much about, which is cybersecurity, as well as data privacy and all these sorts of things that are on people's mind as well. And so, of course, what I wanted to ask is, health data is one of the most private information that people value, right? And so sharing that and the fear that it might be out in the digital world, you have this idea that once something gets out of the digital world, it never goes away. How has Taiwan been able to convince people to give up that element of privacy? I don't see the same kind of pushback that we do in other places, like here, for example, in the US.
Indeed, the national health insurance, as Professor Chou highlighted, is perhaps the main distinguishing character of our response. The NHI has digitalized its health card system since 2003 for the entire country, because when SARS 1.0 came, the original coronavirus came in 2002, 2003, Taiwan only had the IC card in a small test pilot project in Penghu in the Pescadores Island, but the main Taiwan island was still using paper-based cards, and it was not digitalized. But SARS taught us that digitalization of health data really is important, and it's worth investing as a public infrastructure, the trustworthy, mutually accountable relationship, so that each pharmacy, each clinician, each nurse, when they handle your NHI data, they also log as part of their transaction their identity through electronic means. So you always can figure out where it goes wrong. So as a result of that, nothing goes wrong. The NHI had a really stellar record since 2003. And this time, because we've never declared a state of emergency, we have to work with exactly the same data collection points as before the pandemic. So without inventing anything new, we just reused what's already working, like the flash flood and earthquake warning SMS systems, like the national health card systems for pharmacies and so on, so that it's built upon already vetted cybersecurity and privacy frameworks, so people do not have to suddenly place their trust on something new that's invented during the pandemic.
Thank you. I think that, so you've built up a track record of trust over the years,
Yes.
which I think goes a long way.
Mm-hmm.
Any of you have anything to add about the whole issue of data and the privacy and security issues that I know, Lorien, in this country, of course, it's a big problem, right? The mistrust, the disinformation. So what's your take on that?
I mean, the one I would say from the US point of view, I mean, we have a lot of privacy barriers to health promotion. For example, the text messaging project that I mentioned from UCLA, where they sent from the UCLA hospital these text messages to say, you haven't been vaccinated, but you can be. And here's a reminder about that. That is using someone's health data to say that, their vaccination status. And I've worked very much in the world of smoking cessation for years and years and not been able to do those kinds of projects from hospitals because of the privacy issues, like been told, no, you can't message people about their smoking status and offer them a quit smoking program. But I think the pandemic has actually taught us that there is a balance between privacy and health promotion. And you have to take privacy into account, but at times, you go on the side of health promotion because it serves the people in the end better.
I actually want to take a question from an audience member that's kind of related to this discussion. This is from Nathan Liu, and it's to any of you or all of you. And Nathan says that Taiwan has done an extraordinary job managing COVID-19. How could some of the strategies such as digital tracking, national healthcare database, how might they be adapted in the United States? Do you have any advice from our Taiwan friends or Lorien's from policy that you know here? So,
I think that we were so behind in terms of even having a national health system. So that's a big, we wait for that, and then we can do some more. But I think on the front of the engagement and the playfulness that we see with the Ministry of Health and the way that the public is engaged, and I think we could learn a lot because we don't have that same kind of tone, and we haven't built the same trust, I'd say, from our CDC in the way that it's happened in Taiwan. So I think there is a lot to learn. I want to know who's going to be our Shiba dog going forward.
Yeah, I vote for beagles. Yeah, and the one other question, of course, you talk about the fact that WHO and so on now we see a global problem deserves a global response. But as we know, Taiwan is not a member of WHO or WHA, the World Health Assembly, which it used to be. So let me ask my Taiwan speakers here to weigh in on whether you think that the Taiwan's management of COVID, how has that made any impact on that question?
I think really many people in the WHO community really lamented that we only had from Taiwan access to certain scientists, but not any ministerial access through the WHO as other member states have, because unless your vice president is also your epidemiologist authoring the textbook, having scientific access is not the same as political access. That refers to our VP Chen Jianren, by the way, a public health authority. So I think what we have done in Taiwan really is to innovate outside of the WHO curricula, so to speak, that enable our fast response, really, compared to other jurisdictions that adhered to the WHO tempo at the very beginning of the pandemic, so much so that we have organized our own pre-WHA assembly with dozens of economies that are more willing to work with ourselves. And then I think people are really advocating for Taiwan's re-inclusion in the WHA because of the real work that we've done in a kind of Taiwan can help, Taiwan is helping mantra, that we were able to spread the knowledge of not just contact tracing and communication, but also mask donation dedications to international humanitarian aid and also vaccines now.
Yes, thank you. Taiwan has been very good, and your ministry includes social innovation. So innovation, I think, is something that's very, very important and works well in Taiwan. I have another question actually from my colleague Rebecca. Russell. And this question, I think, would be for Dr. Chou. And this question is that how strong is citizen support for continuing sort of the COVID zero policies? You talked about surveys that you've done, and especially, is there an end game for eventually learning to live with COVID? What do you think the public sentiment is on this, Chelsea?
Right. Yeah, I think right now the public mindset is really still in a zero case pursuit. The goal is to still keep a zero case scenario. So I guess because I'm not from the government, so I guess this is really a potential challenge for the government to draw its future policy. And because we are right now keeping a very convenient and normal daily life, and if there are more cases, I guess it will really impact our daily life. So I guess it's it's a challenge, I would say.
Yeah, let me follow up on that, Chelsea, from the survey that you did, because I know you had to rush through that a little bit. Is there any other information that you want to share that you didn't get a chance that you'd like the audience to know?
Because all the survey needs to be done through some regression analysis. So I haven't done the regression analysis, so it's hard to show the results. But I guess one thing I want to emphasize is that the communication with its people between the government and the population is actually very helpful for the people to cultivate and to develop their own public health habits. And also we can see that if you are watching more frequently the press conference done by the CECC, then usually you will tend to wash your hands longer, and then you will use sanitizers, and you will wash your hands when you are returning home, and you will use soap. So I guess this kind of example represents the importance of communication. So I guess for the question about the zero case scenario, I guess it's also there's no sure way for the government. The government probably also are thinking, I think Audrey included, is thinking to create more communication scenarios to let the population know that how to handle with the mindset of zero case and also live with the COVID.
Okay, thank you. Thank you. I don't know if the minister wants to add anything to that. The whole
Yeah, certainly. I think the CECC has said quite clearly that until we reach 3/4, like last year, it was all about 3/4 of people wearing and having access to medical grade mask. And this year, that's obviously not sufficient with the Alpha and then Delta variants. So the 3/4 rule is now being applied to vaccination. Now, I think as of today, we actually got to 3/4 when it comes to the first dose, but the second dose is still a little bit lagging behind. So I think when the second dose approaches 3/4, at least 60%, the CECC will rethink about its border quarantine rules and so on. But at the moment, it's basically using this border quarantine relaxation as a kind of motivation for people to get vaccinated as quickly as possible, especially now for the 4 major vaccines. Anyone who haven't get vaccinated have the free choice. They can choose freely between the 4 kinds of vaccines, which really empowered people who actually feels very differently about the different labels. That's a particularity in Taiwanese politics, in that almost nobody refused vaccination, but people refuse to get vaccinated on particular labels. And then having access to all 4 means that people can get vaccinated as soon as possible.
May I ask what is the most popular?
I think Moderna, because scientifically it's still the most accepted, popular. But if they read certain newspapers, then that would be BNT, Pfizer. And if they read another certain newspapers, that would be Medigen, our homebrew vaccine. I think the AstraZeneca is the most neutral of the four.
Okay. All right. Thank you. Here's a question, a kind of a hard policy question, and I think this is for you, Lorien. It's from Kermit Harrison, who says, Singapore will no longer cover the medical costs of unvaccinated by choice people who make up the bulk of the new COVID-19 cases, as we know, and their hospitalizations. And so the question is, should the US adopt a similar policy? And I suppose one could say, should countries in general, is it something that you would support a kind of policy?
It's a curious, I learned about it a couple of days ago, and I think it's a curious policy. I mean, for one thing, in the US, we don't have the national government paying for healthcare in the first, across the board for everyone for their COVID-19 treatment, which is different than Singapore, where they were covering it. But I mean, of all the policies that are out there, to me, it doesn't seem the most motivating one to start with. So I mean, I see the point, and I think in the US we have more the issue of like overcrowded ICUs, the intensive care units in hospitals, and we have to triage who gets a bed in an ICU. And there has been some discussion about whether people who are unvaccinated, whether they should be eligible for one of those beds compared to someone who's vaccinated. And so that's another similar kind of discussion, and I think probably more relevant to the US context, where where we are short on ICU beds in certain places, and so that is an issue. And certainly the ones who are vaccinated are more likely to survive, and that does go into some of the triage decisions, I think.
Right. I suppose it's a question of a carrot versus a stick kind of approach here.
Right.
And clearly, from what we've heard in Taiwan, it's very much more the carrot.
Yeah, indeed, the stick really doesn't work in Taiwan, and I think the CECC made it very clear that all the essential services, including healthcare, of course, should not discriminate based on vaccination status. It has been a very stable message that we've been sending out since half a year ago. Yeah.
Okay. All right. So here's just a very empirical question here. Gary Sands from Wikistrat wants to know how many people in Taiwan do not possess a cell phone, and so how do they, if you don't have access to that, how do they make a reservation to get a vaccination?
2%, right? We read that statistics, but then they just call the landline, really. The 1922 landline will refer them to their local pharmacist or their local health officer or district officer and so on. And because everyone has this health card, so they can just bring the health card to a nearby pharmacy or more than 12,000 convenience stores and so on. And someone there will help them making the vaccine reservation. We made sure that there's not just very accessible through like the physical kiosks, but also very accessible through a landline.
I see.
I also think that the district executive chief is very helpful in helping people to do the vaccination. So they actually actively to contact, for example, old people and more senior citizens, and they bring them to the hospitals to do the vaccination.
And we only use the nationwide vaccination appointment system for people under 64 years old. At or under 64. So it's almost, by definition, people above 35 will be taken care of by their district and bureau chiefs. Yeah.
Oh, okay. So you do curate your responses by population and demographics, which makes sense. I don't know if you, as I'm waiting for any other questions, whether Lorien, you have any questions for our two Taiwan speakers or vice versa? Feel free to,
I have one.
yeah, go ahead.
So I was really excited to learn about how the Ministry of Health puts things in the Creative Commons or makes them publicly available so the public can then innovate and create things. And I was just hoping to hear a little bit more about that and what kinds of ways you do that and what it has led to.
Mm-hmm. Yeah, it's a nationwide policy. Our open data and Creative Commons policy since at least 2014 spans all the different ministries. And we found that usually the most active users are actually public servants from another ministry. For example, the Ministry of Labor or the Immigration Bureau of Ministry of Interior frequently remix the Ministry of Health communication materials in new immigrants' languages or adapting to fit their culture and so on. So basically, it's public communication expert from across the other ministries in the cabinet office that benefits the most from the first remix. So it's not just about empowering the citizen comedians. It's also empowering the entire communication infrastructure network within the participation officer network. And indeed, we found that when we crowdsource materials and policies like this, like when we crowdsource our tax filing system redesign in 2017, we deliberately assigned the breakout group facilitators, not from the Ministry of Taxation or Finance, but rather like the Sea Ocean Patrol. But when we redesigned the ocean database and access to ocean policies, well, it's the Ministry of Finance leading the breakout groups. And the theory is that what the Ministry of Finance people does is within a silo, but when they're talking about surfing and amateur fishing, well, they take the side of citizens because they also enjoy these sports, and the Ocean Patrol also have to file the tax themselves, and so they become much more creative and take the side of citizens.
Thank you.
Okay, we have time for a couple more questions that just come in. One is from Megan Chang from GW. She says that she wants to know, besides the previous SARS outbreak, what other factors played into Taiwan's immediate COVID response, and what challenges did the government face implementing the quarantine system beyond? So just she wants to know a little bit more about the government challenges in this regard.
Yeah, I think, of course, aside from the initial mask shortage and this May, the initial vaccine shortage, which are the two most present challenges affecting Taiwan, I think another thing really is about the trust that people place to the digital fence system, for example, that we alluded to, that the SMS sent to your phone when you break out of your quarantine district. But it's not a new app, it's not GPS, but still people worry about their privacy and cybersecurity concerns when they quarantine at home. So we basically ensured that the local district chiefs and health officers and so on, instead of the police or any law enforcement agencies, are the first line of response who can take care of understanding the contextual situation better and maybe lend them a phone if they don't have a working the local SIM card or the telecom tower are too far away for that particular telecom carrier and so on. So they are much more flexible and also with a lot more empathy than any top-down way would do. So we overcame it, I think, with the help of the local district bureau chief and local health officers.
Okay, thank you. And I'm going to take one more question. This one is for Chelsea. It's from Peng Shuan, and the question is, the survey that you looked at, it shows that national identity and political stance of the respondents make a difference on people's own response to the government. How do you observe it, and would it become an obstacle for countering the pandemic? What do you take away from this difference you find based on views on national identity that you mentioned?
Right. I think again there is no sure way to overcome those obstacles. So the government definitely is making a more and more communication with different segments of the society. So we cannot deny that there are different opinions toward the government, especially those opinions are rooted in their national identity or their political party ID. But those are definitely posing some challenges. But I think the government is trying to make more communications and to make those policies more and more transparent. I think that's I wouldn't say that there is a sure way, and there's no one way to deal with this. But it's an ongoing process for the government to engage in the communications with the citizens.
Okay, thank you. Since we just have almost, we're really 1 minute over, but I want to take a last question, and this is for the minister. This is from Yani Najarayan from GW. In addition to the QR system and track system, does Taiwan use advanced facial recognition software and thermographic cameras? And how do you ensure the protection of health data and individual privacy? Has the government discussed the continued use of digital tracking once the pandemic is over? So these are, again, questions that related to privacy.
Unlike quarantine, which we pay people around $100 a day for working with us for 14 days. But if you break out of quarantine, you pay us back 1,000 times. But anyway, aside from that, which is mandatory, our QR code-based, SMS-based contact tracing is not mandatory. If you're not comfortable using a phone, even manually texting the number to 1922, well, you can always opt to use pen and paper or ask some people who accompany you to check in on your behalf by writing +2 or something on their SMS. So it's very flexible. We're not really mandating it at any time, but mostly because we've never entered a lockdown. So I think if individual venues, certainly not public venues, implement such additional measures, such as thermographic cameras, they have to, of course, abide by the Personal Data Protection Act, which is modeled after the European Union one right before the GDPR. So the appealability, accessibility, accountability, and so on are, of course, concerns. And people do have a choice. I mean, we do not mandate such measures in our essential services. But if individuals, say nightclubs and so on, which are due to reopen anytime now, right, decide to adopt such mechanisms because they're not essential services, they have to just abide by their own PDPA, personal data protection rules.
Thank you so much for that clarification, especially the way in which it's harmonizing with the EU rules on privacy and data, which I think many of us have heard about, but we have not heard this aspect of Taiwan's laws. So thank you very much. And on that note, I'm happy to say that we have had a very stimulating discussion, learned a lot, speaking for myself. And I think we hope that Taiwan's experience will be something that the rest of the world would somehow be able to share going forward. And it was a pleasure to have the minister return. And I really thank you for taking your time from what I know is an extremely busy schedule, although you said that this was sort of a fun time for you, so good. I'm glad that you started your day off with us. And to my other colleagues, thank you so much for joining us in this late hour. And thank you to the audience for joining us today. I hope you learned something. And I want to invite you all to come back. We have our last Taiwan Roundtable of the year coming up in about a month on December 6th. And this topic will be looking at something called shedding Taiwan's invisibility cloak, how it can gain greater international space. So we touched on that a little bit on the WHO question, but there's more than that. So I look forward to seeing all of you back. And until then, stay safe and good night.
Thank you.
Good
Live long and
morning.
prosper. Bye.
Bye-bye.
Bye.